My name's Elaine Dunne. I work as part of the Health Protection Team and the National Infection Control Team in the Irish Prison Service. We as a team, Ronan and Elaine are over there, we're all part of a team. We're based in Portlaoise and we're part of the rollout of this programme across all 13 estates. So just to put a little bit of content on this presentation, I'm just going to give a little bit of background on the prison setting, background of where this all came about, some of the work that we've done to date in collaboration with the HSE and the future vision. So the Irish Prison Service is made up of 13 prisons, and that's across all of the Republic. 2 of those prisons are open prisons, and then there are 2 of the prisons actually accommodate women as well. The total number of prisoners now currently is approximately 4,970 compared to 2020 when it was 3,676. So we're hugely overcrowded at the moment, as in a lot of other services. This was a study that was done in 2019, and there is a recidivism, word I can't say, 62.3% over 3 years. So it's a very transient, it's a very movable population within prisons. There's a high prevalence of addiction, poverty and homelessness across all prisons, and we would experience that firsthand within the prison. Approximately prison staff across 13 sites is about 3,400. That doesn't include the external services, so we're a good employment group. So obviously the numbers don't lie. It's a really captive audience. There's a really high population that we can actually target from a prisoner and a staff perspective. Prison itself is a very, very challenging setting. Some of this may actually, from whatever areas you work in, it may be a thing. But obviously, prisoners, they're actually serving a period of sentencing for whatever that might be. So health may not be their primary concern at that time. They could potentially looking at a life sentence. So, obviously trying to encourage this cohort to actually address their health and well-being while in custody is a challenge in itself. You're trying to, utilise their time in service that they can actually improve their own overall health and well-being by trying to empower them. The prevalence of smoking amongst this group is quite high. It's 3.7 times higher than it would be in the general population, and that would maybe because of their higher incidence of addiction and mental health. Historically, the education amongst this population group would be quite poor. They wouldn't necessarily engage with potential services in the community. So, when they come into prison, that may be their first exposure full on with any sort of health interventions. It's a really, really stressful environment from a staff perspective and from a prisoner's perspective. It can be quite a daunting, I like to think none of you have ever been in prison, but it is a daunting experience being in a prison. I mean, the staff are there and it can be at times a very sedentary job. But then at all times, if an incident or if there is, you have to attend to emergencies at a thing. So you always have that kind of, and then prisoners, obviously, they're in a stressful environment. They're very disempowered once they come into the prison setting. They're in a shared cell with maybe 2 or 3 other people. They're told when to get up, they're told when to go to bed, they're told when to eat. So it can be a very disempowering environment for the prisoners. And access is very difficult for both cohorts. But you were mentioning a lot of, all these webs and access to apps and everything. From a staff perspective in the prison, we don't have access to phones. So by the very nature of working in a prison, you're excluding yourself from whatever that might need. Legislation, some of you probably are aware of this, but we're exempt in that from a workplace setting perspective. It's deemed as a home for the prisoners, so they can actually smoke in their cells. So, and that's in legislation. So that's a challenge in itself, trying to introduce, smoke-free areas. Ventilation in prisons is really, really poor. They're old historic buildings. So if you're looking at secondhand smoke, if people are smoking, there's no way for it to move. So people are being exposed to secondhand smoke, albeit my understanding, no studies have been done, but I've no doubt if you've been in prison, you can actually visually see the smoke. Unsocial hours from an operation staff perspective, work long hours, sometimes you have to do really unsocial hours like 8 in the morning to 8 at night, but then sometimes if there's, emergency situations, you would be expected to work throughout the night as well. So everything is kind of going against from a staff perspective, engaging with services in the community. Resources, similar to what I have no doubt all people are experiencing, resources in-house is limited. We're a very small team and we're trying to roll it out across the estate. Shared accommodation, as I've mentioned, prisoners, In the most part, they can look to be in a non-smoking cell, but it depends with the overcrowding. That really is challenging to try and think. And as I've mentioned, overcrowding. Some of the physical challenge, just from a pictorial, so this is what we would refer to as the main gate. So just to put it in, so these are staff would be coming in this on a daily basis. It's like going through the airport, but you're screened, your mobile phone's taken off, and so it's challenging yourself getting from A to B. And the HSE that were actually involved with the programme we ran out, they actually would have mentioned that it's actually difficult getting into a prison. And we all take comfort in that, I guess, because it's difficult to get out as well. And then obviously that's just kind of an idea of a cell. So, that's actually quite a glamorous cell, but that's in a new prison, but cells would be a lot smaller than that, and it would be really dull, and you could have potentially 3 people inside with shared toileting, somebody on the floor. Just put it into context. And again, that's just an idea of what a landing would look like. So all those gates would be closed. So every step you go through a prison, you're met with a gate, you're met resistant, big bunch of keys, ventilation is poor, and just to give you an idea. So where did this come about? So there was a pilot programme done with the Tobacco Free Ireland and the Mountjoy prison pre-COVID. And how that was, it was the first of its kind, and was just to see how actually in such a challenging setting, we can make it more amenable for people quitting and addressing their tobacco habits. It was a whole of prison approach in that both staff and prisoners were addressed in one particular area of Mountjoy prison. Tobacco Free Ireland were hugely supportive they provided the additional training required for the healthcare staff and the operations staff to deliver the programme to the prisoners. And also they got the staff in that particular area were involved in it. There was 58 and 30 people actually quit. There was 7 staff employed, and it was very much an opt-in approach. 7 staff worked in this particular unit, all of whom smoked. They all became involved, and all 7 quit, which was brilliant. Of the prisoners, there was 51, and of that, 23 were successful. And it was very much evidence. I'm not doing it justice with that little diagram, but there was lots of different components. They looked at, exposure to secondhand smoke. They looked about their mental health and well-being. They looked at lots of different things. But overall, it proved that actually, if the correct mechanisms are in place, it actually is successful in such an environment. So what next? So obviously, COVID came, and then after, so obviously the evidence was there if, it is possible in this environment. So that's where us as a team, we kind of were responsible or to kind of get this project off the ground again. So these are all no particular order. So we obviously got the green light, because obviously we had to make sure that we got the governor from a governor, and I know, Elaine, you're always with this terminology, but the governor would be the main rank within a prison setting. So he or she, they would have to decide, okay, this is something that we would like to consider from both our staff and a prisoner perspective. We would engage them with the Tobacco Free Ireland to get introduced to the relevant CHO of that particular area. In collaboration with the HSE, who I can't state, they've been hugely helpful to us. A bespoke education piece would be delivered for both staff and to prisoners at different times. We would primarily take over the role of delivering to prisoners, and the HSE with ourselves would deliver to the staff. But a key part of that would be obviously your carbon monoxide, and also it would be emphasis on your second-hand smoke. So then we would look to how to recruit in that particular prison, different approaches. So from a staff perspective, the governor, he or she would send an email out to all staff how they can actually sign up, and that would generally come through us, and then we would engage with the HSE and say, we've X number for this prison, is it something you could consider coming on site? So the HSE, as I said, would provide the staff supports, and how that looked like, and which we would strongly believe was a huge advocate for the success of this. They actually would physically come in on site and deliver the one-to-one to the staff members that were interested in becoming involved. And then we would train up. The Red Cross training refers to, there's special status prisoners. They're trained up to a certain standard, and they're known as Red Cross volunteers. So we would utilise them, and we would train them up to become, smoking cessation facilitators to their peers. It's adapted on the smoking cessation program, the community, but it's very kind of literacy led, as in it's very pictorial to make it a bit more simple for them, because we would be putting a lot of responsibility on these prisoners to actually deliver to their own peers. So that's how, try to capture the bigger audience, because obviously we do know from experience, peer to peer, the prisoners listen to their own. They don't necessarily listen to healthcare or other staff as well. So access supports, so obviously that's from a logistically perspective, a lot of work would do that in making sure from the HSE perspective, physically getting in and out of prison, how that would look, where they would deliver their programs to the staff, how the staff would know when to come for their appointment whilst they're on site. So that, and then obviously the implementation and continuous evaluation to ensure it's working from both the staff and the prisoner perspective, and that would be continuous. We've done it to date in 5 different prisons. So our first 2 prisons would have been in the Docas and Arba Hill. And Gail at the time, she would have been heavily involved from a staff perspective. So Docas, you can see there, there's 4. So it's actually the employment for the Docas and Arba Hill, they're actually smaller prisons. So there was 4 staff that decided to come in, of which 1 was successful. And then you can see from a prisoner perspective, 18 and 12. And just to note, within the Docas, from a prisoner perspective, with the management within the prison, they actually identified a smoke-free area within the Docas, which we were so grateful of. So that actually lended itself for the prisoners wanting to become involved, because they knew they weren't going to be exposed in their cells. Arba Hill, again, is a small prison. So the staff was 7 and 5 were successful. And both of these prisons have since actually looked to run this programme again for the staff. So we would take comfort in that. And then Cork, you can see by 2. So Joan down in Cork, she would have ran the programme twice on site. So that we would flee, that's where the rollover. So she ran 2 programmes and 12 people would have been involved, of which 6. And you can see them from the prisoner's perspective. And Portlaoise staff, that Helen was hugely involved in that. And again, she ran the programme twice. She was probably in a more opportunistic thing, because she was across the road, so it was easier for her to go inside on a weekly basis. So we were really pleasantly surprised with all of those. Lucan staff, there wasn't an appetite for staff. We don't know the reason. From a prisoner perspective, to 11-7. So just puts a little bit of context into. And these were when all the different things. Now, we had to slightly do it, adapt it compared to what we would have done for what the Tobacco Free Ireland did, the pilot programme, because obviously the resources and everything, we had to adapt it, but we were happy with that. We spoke to some of the HSE that would have provided the on-site supports to us, just to get a kind of a picture of how they felt with this intervention. So they just mentioned some key words. Leadership was key for them to ensure it was going to be seamless with them engaging with the staff on site. They all acknowledged it was a very, very different settings to what they were used to. Made reference to, to be aware that you're not going to be in a nice little office. You could be in whatever different area, but just be mindful of it. Education, they said, was key for the integral staff engagement. They had advocated it's beneficial to offer continuous access. She mentioned that actually she didn't come in one period and she lost a few, so she said it's something for her to do the continuous engagement on site. They all mentioned that the staff that they engage with, they reckon the peer support, that camaraderie in the prison setting was hugely advocate, because they were nearly being competitive with each other, saying, how are you getting on? They all acknowledged that staff were very appreciative of this initiative, and they all decided it was hugely worthwhile to actually address this hard to reach cohort. So I spoke to 2 staff that actually would have been involved in the programme. One staff member, he said he just feels brilliant, he's now quit. And I thought it was a lovely statement. He said his family spoke about him being a new presence about the house. So he was actually there, because he said it was consistently going outside for a cigarette break or whatever he was doing. So his family, his children said it's like a new presence about the house, and he was so happy about that. He mentioned again about the crack amongst the peers. He said he cannot underestimate the supports from the HSE on site. and that was across the board. It's the first time probably the staff have been given, the access to actually engage with something whilst working. They acknowledged the HSE provided the reassurance and the confidence to quit. They mentioned money in their pocket, which they never would have had before, that actual change. And one guy who was involved with Joan in Cork, and he doesn't mind me mentioning her name, he was so proud he retired as a non-smoker. He was smoked all his career and he actually retired as a non-smoker, so this was huge for him. We engaged with some of the prisoners, just 2 of them, and so one guy he started to feel better about himself. His mental health improved when he actually quit. He had 5 attempts beforehand and this time it worked. He said the supports in the prison, when he mentioned this, it was like as if they really wanted us to quit. So he was making reference to management within the prison because they were trying to actually aid him on his journey. He was actually a facilitator and helped me whilst he helped others. So he was actually a smoker as a facilitator, but it actually helped him in his journey whilst he was helping others. He made reference to speaking to the lads. They made reference that smoking is the biggest problem. They can't afford tobacco and the stress not being able to buy, and he just made reference to need more groups. That was something that both these lads had worked on. They actually did like an A4 essay, which was, we were very happy about that because it was actually their true story of what they were experiencing. This is another guy. He started smoking at 8. He's now 45 and quit. He said the group was a support key for him. That was really integral for him. He was sick of the addiction and the habit. He'd bypassed surgery and his recovery was seamless, and he refers that because he quit. He said, quitting in prison truly tests you, but I am proof that if it can happen, and I 100% would recommend programme, I think the support group should last longer. And he said he was so proud. So the future vision from our perspective would be, we would hope that we can expand this to all prisons from both a staff and a prisoner perspective. We would love to see that we can, look at exploring additional supports to prisoners, because we're very mindful we actually are putting a huge responsibility on the prisoners delivering this programme, along, serving a sentence, whatever that might be, and to kind of explore ways of how we can do a continuous rollover for the prisons. So keep going back, because we do know it's a very transient population. And lastly, I'm probably speaking very fast and I do apologise, just a huge thank you to Tobacco Free Ireland and the HSE colleagues. So without them, from a staff perspective, we couldn't have done this, and it's just, we're really, really happy. Prison staff management, healthcare operations staff, and of course the Red Cross volunteers, which would be the prisoners. Thank you very much.